Okay, good afternoon, everyone, and welcome to the webinar entitled Connecting the Dots for Joint Health and Safety Committees in the Hospital Municipal Health Sector. Before I move on, can someone just let me know if you can hear me clearly in the chat? Perfect, thank you. So my name is Felicia Forbes, and I'm the CUPE National Health and Safety Representative, and I'm also joined by the other National Health and Safety Representative, Paul Sylvester. A reminder that the presentation will be recorded and posted on the CUPE Ontario COVID-19 website. If you have any questions, please post it in the chat bar, and we will try and answer as many questions as we possibly can before our 60 minutes is up. Please ensure that your questions are of a general nature and not workplace specific. As mentioned, this theme of this webinar is connecting the dots. Although the COVID-19 pandemic has had a profound impact on workers, it's important to remember that the law and principles of health and safety remain the same. The presentation today will serve as a reminder of the minimum standards in the Health and Safety Act and how to ensure the workplace is implemented measures that will protect workers from exposure to COVID-19. So before we begin, I will note that you do not need to create a Skype account in order to participate on this call. You could just log in as a guest. So for any folks that know others that are having issues logging in, if you could just let them know that you can log in as a guest, you just have to enter your first name and they will be able to join the webinar. So what we will be, sorry, I'm just waiting for this to. So what we'll be covering this webinar is internal responsibility system, duties of employer and supervisor and worker under the Occupational Health and Safety Act, powers and duties of the Joint Health and Safety Committee, due diligence and how it encompasses the general duty clause and precautionary principles, hierarchy of control, and how COVID is a hazard and related to our workplaces. Now
Thanks.
We're going to
go ahead. Thanks, Alicia. So right now we're going to be talking about the internal responsibility system, and it's a concept is which the Occupational Health and Safety Act is based on. It's based on this philosophy that workers and employers are the best placed to solve the workplace issues when it relates to occupational health and safety. And since the Act is written in such broad terms, and because it applies to so many workplaces, it is set out that workers have a shared responsibility in the workplace to ensure that workers are safe. Now, it's not an equal responsibility, as we will later find out in the duties of the employer, is that the employer does hold the bulk of the responsibility to ensure that the workplace is safe. But we should also bear in mind that there is this shared responsibility and that workers and employers should be on the same level at all times to make sure the workplace is safe. And at any time, either party can go to the Ministry of Labor to seek either enforcement or to assist in compliance with the Act. So the internal responsibility system, and for the IRS to work, to be effective, employers, supervisors, and workers and other workplace parties need to have practical knowledge, training, and skills to control workplace hazards. And you'll often hear the word manage hazards, and we'll find a little bit more about what a difference between controlling a hazard and what managing a hazard is later. But it sets out this idea that we want it to be effective. A component of this IRS is a functioning committee that is identifying hazards and making recommendations to improve workplace conditions with the goal of preventing accidents, illnesses, and lost time injuries. If any one of the workplace parties is not fulfilling their duty, then the IRS is not working. This is very important. So you have to kind of look at, if you're a member of Joint Health and Safety Committee, and that's who our audience is really for today, is to ask yourself, is your IRS working? Do you have a functioning committee? Are you out there identifying hazards, and are you putting in recommendations to improve it, especially now that we're dealing with COVID-19? Felicia is going to talk to us about the duties under the Occupational Health and Safety Act.
So there's various duties under the Health and Safety Act in relation to employers. We're not going to cover the entire every single duty, but we are going to highlight ones that we feel are very relevant, will be useful for you folks to take back into your workplaces during the era that we're in right now. So under the Occupational Safety Act, under section 25 and 26, you can find the duties of the employer, and I'm just going to review a few. So we need to ensure that prescribed protective equipment, materials, and devices are provided and in good condition and used in the workplaces. So for the purposes of you folks in this webinar, you folks would fall under the healthcare and residential facilities regulation, and that's what it's alluding to when it says prescribed PPE, where it talks about what does that good condition look like and mean. You need to ensure that the measures, procedures, and training as prescribed are carried out in the workplace. Providing training and information about the hazards of the work, right? So really understanding what comes with COVID, how is it transmitted, proper training on perhaps how to do proper screening, how to donning and doffing PPE and things of that sort. And appoint supervisors who are A, familiar with the work that you're doing, B, aware of the hazards that are in the workplace, and C, familiar with the Act. Okay, so they understand what legislation they're obliged to be in compliance with as well. So then we continue to preparing written policies for occupational health and safety, violence and harassment, and developing programs that implement these policies. And those policies could look like a pandemic plan. It could be infection control plans that are probably existing in most of your workplaces, considering the nature of work that you folks do. And making sure that they're not only just writing these policies, but actively implementing them as well. Affording assistance and cooperation to the health and safety representatives or committee in carrying out their duties under and rights under the Act, which we will later highlight. And provide a health and safety representative or committee the results of a report respecting occupational health and safety in the employer's possession. So this could be things like hazard reports, WSIB reports, exposure reports, especially during this time that they should be providing you folks in order for the committee or the health and safety representatives to be able to carry out their work in terms of identifying hazards and actively putting in and recommending measures to suggest to the employer so they can protect the health and safety of the workers in the workplace. Also, notices of accidents, incidents of workplace violence, and occupational illnesses. So they have a written notice that they have to provide to the health and safety representative or the health and safety committee and the union in the event of an event or an incident of workplace violence that requires medical attention or disables a worker from their usual work, or a worker who has suffered an occupational illness or has filed a claim of occupational illness with WSIB. And this written notice is provided within 4 days of the occurrence. So we are encouraging and highlighting this for you folks to note because as you may have heard from most of your staff reps, that if you feel that you've possibly suspected cases from COVID that you may have contracted, or you feel like you've been exposed to it, we are recommending that you folks do fill out exposure forms and file a claim. And if you know that that is happening within your workplace, you should be receiving a notice from the employer within 4 days of that occurrence if you are the health and safety representative or on the committee and a part of the union. So duties of a supervisor, again, not going to go through all of them, but just highlighting some key ones for you folks. So under the Act, you'll find this under Section 27. They must work in compliance with the Act and the regulations, They must ensure workers are wearing protective equipment required by the employer to be worn. They must ensure that safety measures and procedures are established by the employer or regulations are carried out within the workplace. And not most importantly, but very important, acquaint any worker with hazards in the workplace to which they're aware of. Then we move on to the duties of the workers, which you can find under Section 28. So similarly to the supervisor, workers must work in compliance with the Act and the regulation. They must use or wear PPE, equipment, clothing that the employer requires to be worn. And I just want to note that this is not to say that if the employer is requiring workers to wear equipment, protective devices, or clothing, that it needs to be in that good condition as we highlighted earlier. And it needs to be not a way that will create a hazard for workers, but it has to also essentially protect their health and safety if they're required to use or wear it. They also must report to their supervisors the absence of any protective device, any defective equipment, or any contravene of the act that is likely to endanger a worker, and not remove or make any ineffective any protective devices or operate any equipment, device, or machine that may endanger themselves or other workers. And that's why we want to encourage you folks as health and safety representatives and committee members, because at the end of the day, you all are workers, to make sure that you are reporting any defects, any inadequate equipment or PPE to the supervisors and the employers to make sure that it doesn't endanger yourselves, but also your other coworkers, because you do have that duty under the Act. Now I'm going to turn it back over to Paul.
So now we're going to talk about what are the powers, the rights, and the functions of a Joint Health and Safety Committee and a Health and Safety Representative. And we're not going to get through all of them, so we're just going to highlight a few key ones. And also included with the invitation to today's, with the link for today's webinar, we included 4 attachments, and 2 of those are attachments are little cheat sheets that I've provided, which give you an overview of what are the powers, the rights, and duties of a Joint Health and Safety Committee, and what are the employer's rights when it comes to providing the committees with information, and how do they respond to recommendations of that nature. So after today's presentation, you can go and review and make sure that the employer is compliant with all their duties under the Act, and that your Joint Health and Safety Committees are exercising all those rights and powers that they have. So just going to remind ourselves, a health and safety representative is required at a workplace where between 5 and 19 workers are regularly employed, and that's under Section 8 of the Act. And a Joint Health and Safety Committee is required at workplaces where 20 or more workers are regularly employed, and you can find the majority of those the duties for the committee under Section 9 of the Act. Now, both the Health and Safety Representative and the Joint Health and Safety Committee, if you have one or the other in the workplace, they have similar powers and functions under the Act, except that Joint Health and Safety Committees have meetings. And you'll have, then we have to remember that the Act is sets out minimum standards. So even though we're going to be talking about minimum standards under the Act, you might have either language in your collective agreement, or you might have a terms of reference which set out higher or greater rights than there are under the Act. So it's important to keep those in mind as well. So the roles of the Joint Health and Safety Committee or the representative is to identify situations or conditions that are a hazard to workers, obtain information from the employer concerning those hazards and processes and equipment, and similar information that might be going on in similar workplaces. And based on whatever the committee is identifying and obtaining information about these hazards, they have the power to make recommendations to the employer to improve workplace conditions. And these are the big lines of what a committee is doing. And if we're not engaging in this kind of continual identification and this remediation of making these recommendations to the employer, then your internal responsibility system is just not going to work. We're going to touch briefly on multi-site and single-site committees because some of you might have the different setup in each workplace. So a single-site committee is a standard committee that you would have at one workplace. So it's one workplace, one committee. But in situations like hospitals, you might have situations where there's a multi-site, which means that where so permitted, a multi-site committee may be established. And in this case, it's one committee can be established for several workplaces under the same employer instead of a single committee at each site. Now, if you have a multi-site, they have the same rights as a single-site Joint Health and Safety Committee, except they must have terms of reference that must be signed by both parties and approved by the MOL. Now, these terms of reference will just set up who is the like how often do you meet, what is the structure of your committee, how often you're going to do your inspections, who's going to do those inspections. It is not required in single site committees, the terms of reference. However, it is good to have them, or it's good to have collective agreement language, or if you can, with your employer, come to some kind of health and safety agreement, which will set out how the committee can achieve that internal responsibility system to ensure that you're meeting all the duties and functions of the committee. Talk about inspections is that every workplace shall be inspected by the designated worker member of the committee every month. And annual inspections are allowed only with ministry approval. And there are a few terms of references that are kicking around there that say that their annual inspections are permitted. However, we're of the opinion that every part of the workplace should be inspected at least monthly. And during this time, COVID-19, workplaces still should be happening every month. The Act says the physical condition of the workplace shall be inspected. However, there's nothing preventing a member in talking with workers or looking through health and safety related documents during your inspection. And a management representative of the committee may accompany the worker representative during this inspection. However, it's important to remember that this inspection is the worker's inspection. And sometimes if you have a person who's a management representative who's accompanying you during this inspection, it's sometimes good to have them out there so that they can really see what the workplace is like and you can have that ongoing dialogue. However, if the management representative is continually wants to argue about what is a hazard or what goes on in the inspection, what doesn't go on in the inspection, then they're not really engaging and they're not really being helpful in that situation. And they can be asked not to accompany you unless it's come to an agreement that they have to be there. But in general, there's no legal right for them to be there. And unless they're going to assist you and provide cooperation, they should not be there unless they're going to do that. Meetings. So the committee must meet at least quarterly. And like I said, you might have different language within at your workplace that says that you meet more often. But the important thing about meetings is they have no fixed time limit. And I hear a lot of committees tell me that, oh, well, we can only meet for 3 hours and that's it. Well, that's not the intention. If you're only meeting every 3 months and you're meeting for only 3 hours and there's still items left on the agenda, well, there are items to be discussed, and a meeting should be set up as soon as possible so that the meeting is continued and that you're ensuring that you're covering all the required elements that are on the agenda. And quorum is not set out in the Act. But a quorum is established by terms of reference or a health and safety agreement. And it's important to remember that at no time will the number of management representatives exceed the number of worker representatives. And during the meetings, minutes must be taken and conserved. And voting is generally not recommended because we want the issues to be resolved through consensus. It's important to have that ongoing dialogue to ensure that everyone understands everything that's being brought forward, everyone understands that it's important for the committee to look at. Co-chairs. So every committee shall have 2 co-chairs, 1 co-chair from management selected by management and 1 co-chair from workers that are selected by the workers on the committee. And co-chairs, their duties include, even though it's not set out in the Act, their duties should include chairing the meeting and alternates and prepare the agenda, sign the minutes, and approve guests to attend the meetings. And either co-chair has the power to put forth a recommendation if the committee has, in good faith, failed to achieve consensus on a recommendation. So let's move on to recommendations. And also attached with with the link for today's webinar, we've provided a sample recommendation. And that sample recommendation you can use for your committee to all you have to do is just include the hazard or include the contravention of the act that you want to highlight. And you have to basically just plug and play whatever particular situation you're dealing with at your workplace. And hopefully, since this COVID-19 crisis has started, that you've actually been putting forth recommendations, because there's a lot changing right now. And we want to make sure that the committee is involved in making positive change in your workplace. Let's review your recommendations. So a Joint Health and Safety Committee or a Health and Safety Representative has the power to put forth a recommendation to the employer, and an employer who receives a recommendation has 21 calendar days to respond. The response must include a timetable to implement the recommendation, or if refused, an explanation justifying their rejection of the recommendation. It's very important that they set out exactly what they're going to do with the recommendation. And either co-chair, as mentioned, has the power to put forth a recommendation unilaterally if the topic is brought to the committee in good faith and they have had a good discussion about it, but you just haven't achieved consensus. This is an important power of the co-chair, because in situations where you have an employer who is turning down recommendation or doesn't want to necessarily engage or have things go to the employer for whatever reasons that they have, after you've had a good discussion at the committee level, if you're still arguing about it, you can end the discussion and just say, okay, well then we want to put forth this recommendation. And with that recommendation, the worker members or the local will have a better idea if it's turned down, if the recommendation is turned down, if they want to bring it to the attention of the Ministry of Labor. This is an important thing, is if you're a member of the Joint Health and Safety Committee, there's no obstruction. No person shall hinder, impede, or interfere a committee member in the exercise of a power or performance of a duty under the Act. And no person shall provide false information to a committee member in the exercise of a power or performance of a duty under the Act. You can find that in Section 62 of the Act, and this is very important because for that IRS to work, there has to be this level of the committees being able to fully and freely exercise their powers to identify hazards, to obtain that information, to make those recommendations, and to be part of those inspections, and really to improve the workplace conditions, and to ensure that they're done freely without any kind of influence or people providing them with false information. So I'm going to turn it back over to Felicia now, who's going to talk to us a little bit more about due diligence.
Okay, so the general duty clause can be applied where no regulation exists, but the reasonable care to protect the worker does exist. So the general duty clause is a broad responsibility of the employers and the supervisors to ensure that health and safety of a worker, as well as other workers at or near the workplace, can be impacted by the employer's operation. And in Ontario, the clause is 25 subsection 2 sub H. So that reads as, an employer shall take every precaution reasonable in the circumstances to protect the worker. And it's a similar clause for supervisors, which you could find under 27(2)(c). It's important because the general duty clause is something that we do heavily rely on, like we say, when there's no regulation that exists. In the time of COVID, when there's no new regulation that's come out, or there hasn't been a directive or a guidance note that the ministry has provided. If you are calling in, for example, making complaints to the Ministry of Labor, this is something that we are encouraging you folks to turn your minds to and to make an argument to the inspector as to why this is not being applied. The employer is not adhering to this, because the general duty clause is supposed to be looked at from not a narrow view, but from a broad view, right? Making sure that you're encompassing and looking at everything as a whole, but not in a narrow-minded scope view when we talk about the reasonableness of protecting a worker, and really looking at take every precaution reasonable, not just one or two and forget the 17 other ones that are probably more effective and should apply. So an example of that could be not taking every reasonable precaution, that is, and I'll use an example from the time of now, that their screening protocols aren't as aggressive as it should be. So they will screen let's say visitors that are coming into the building, but if they've seen that person that delivered that package 2 days ago, they're not rescreening them. And then all of a sudden, you know, we have exposure to 17 different people because that person actually did have a suspected case that was actually confirmed later on, right? That we would say you weren't taking every reasonable precaution and turning your mind to the circumstances of how to protect the worker in relation to the hazard of COVID. And the Ministry of Labor has adopted the standard from Canada and the US to measure the impact of the task and loads on the human body. So we need to consider that again when those guidelines aren't being enforced. However, again, as we said, the inspector can write those orders under this piece of legislation. So due diligence. It's important to identify and equate a member with all hazards and sources of potential danger in the first step of an employer establishing their due diligence. And that means that the employer or the supervisor has the duty to take every precaution reasonable in the circumstances to avoid both harm and offense against the Occupational Health and Safety Act and any applicable regulations. The exercise of due diligence should be done before anything happens. It cannot be considered due diligence if the health and safety measures are implemented after an incident, accident, injury, or occupational illness occurs, right? So it's kind of that whole idea of making sure that we're being proactive and not reactive, right? Again, we're looking at COVID as another hazard in the workplace, and this is not the first biological hazard that has been present, particularly in your sector. So the employer should be looking at it before anything happens and not waiting until, like I said earlier, 17 workers are affected from COVID, and then all of a sudden now you see a pandemic plan that's now materialized, and all of a sudden you've seen now the infection control plan has now included a section on COVID. Telling the workers to act safe in the workplace will not keep workers from harm if the hazard still exists, right? We need to make sure that the employer is acquainting workers with the hazard and making sure they have a true understanding on what it is, how to navigate through it, and providing clear instructions and training around it. Workers may make mistakes, but if proper controls are put in place, the impact of exposure of a hazard, injury, or illness will be less serious. And to ensure compliance with 25(2)H, all hazards and risks of the work must be identified, assessed, and controlled, which we will be going into a lot further near the end of the presentation in regards to controlling the hazard of COVID in your workplaces. The precautionary principle. Now, this is a really important principle for you folks to really understand and take on as a mythology in my mind is how I look at it. And this means that it's taking prudent action in the face of potentially serious risks without waiting for the completion of further scientific research, right? So why don't we just go above and beyond rather than waiting for a report to confirm what we already may suspect? is kind of the idea. And here's a quote that actually came from the SARS Commission back in 2003, I believe. So the point is not who is right and who is wrong about airborne transmission. The point is not science, but safety. Scientific knowledge changes constantly. When it comes to worker safety in hospitals, we should be driven by the scientific dogma of yesterday or even the scientific dogma of today. We should be driven by the precautionary principle that reasonable steps to reduce risk should not await scientific certainty. Until this precautionary principle is fully recognized, mandated, and enforced in Ontario hospitals, workers will continue to be at risk. And that's why you folks have seen so much push for us, where we're looking back on what happened with the past and trying to learn from the mistakes and things that we did not turn our mind to because we were being reactive and not proactive. And I'm going to turn it back over to Paul to talk about controlling hazards.
So first of all, let's remind ourselves what exactly is a hazard. And COVID-19, while being a complex hazard, we have to remind ourselves that it is still a hazard and it still needs to be controlled in the workplace. And it is a source of potential damage, harm, or adverse health effects on something or someone. So when we talk about hazard control, we want to try and effectively ensure that they're controlled and that they're not, in fact, harming the workers. And to effectively control a hazard, it is important to understand what the hazard is actually about. And the most common way we analyze hazards is through a hazard assessment using the RACE principle. So the RACE principle is R for recognize, A for assess, C control, and E for evaluate. When we talk about recognize, what we mean is that we're identifying the hazards in the workplace through the inspections, through surveys, hazard mapping, accident reports, near risk reports, test results, and how we observe the workers working in the workplace will help identify. And once we see how the workers are, we've identified what the hazards of the work are, or if there are any new hazards, we have to then assess them. And that means we need to learn everything about the hazard, its source, what training policies are in place for it, what procedures currently exist, what the law says, what the research says, how many employees would be affected, what are the best practices, and if the hazard the worker is exposed to the hazard, what health effects will it have on the worker? Once we've gathered all of our knowledge together, we're going to try and have to find out how we control it, which means that we want to apply the hierarchy of control. And you've probably heard these many times as being members of the Joint Health and Safety Committee. Can we control it at the source? Can we control it along the path? Or can we control it at the worker? Or is there some combination of them all that we can use? And once we've applied that control, we must evaluate to determine that the control, is it still protecting workers at the end of the day? And I know there's a lot of things that are happening right now, and the shifting landscape of our workplaces when it comes to COVID-19 is always training. And if there was ever a time where Joint Health and Safety Committees needed to be brought to the forefront, it is right now. And that's why we keep pushing this idea that the committees are the best placed to make those suggestions, because they're the ones who are going to understand the work that's being involved and to properly do these kinds of assessments to determine if what currently exists is it protecting workers. I think you might all have an answer what that is. So hazard assessment. So when do we do a hazard assessment? Is we do it before any new workplace policies, programs, processes, or activities are introduced. Before changes are introduced to existing policies, programs, processes, or activities, including when products, machinery, tools, or equipment change. And when hazards are identified or new information becomes available about existing hazards. And if you're a member of the Joint Health and Safety Committee, all these policies and programs that we've been talking about, IPAC and PPE and the pandemic plans, these are all plans that programs that should be done in consultation with the Joint Health and Safety Committee. And whenever new information comes out, or if they're going to modify the policies, those committees in the healthcare sector do have the right to be consulted and to provide input on those new programs. So where is it hazard assessment required is also required where the worker is likely to be exposed to the hazard, or where the exposure is likely to cause injury or illness. And here's the hierarchy of controls. And all occupational health and safety hazards can be controlled using the hierarchy of controls, where the most effective way to control a hazard is at the source through elimination or substitution. And if it's not possible to control the hazard at the source, the next step is along the path using engineering or administrative controls. And the next step is at the worker using personal protective equipment. And this is the least desirable manner to control the hazard. And you'll see the scale on the left of the upside down triangle is that the most effective starts at the top and works its way down to the least effective. And there's been a lot of talk in the last couple of months about personal protective equipment, and you can see how it's placed at a very lower emphasis when it comes to controlling hazards. So if we feel as if the PPE is not sufficient in the workplace, we also need to consider getting better personal protective equipment, but we also need to consider what other engineering controls and administrative controls can we put in place so that it is like a safety net, that you have multiple safety nets. You might have the PPE, but what else can we put in place so that we don't rely simply on PPE? And we're going to go through an exercise now to just kind of explain. Let's go through the whole race procedure, race principle to determine how we can apply this COVID-19.
So as Paul went through to break down the race, we're now going to go through it as applies to COVID-19. So we need to recognize in the first bit. So we need to look at identifying what are the hazards of COVID and who are at risk, right? So what does that come with? How is it transmitted? Who is at risk of exposure and who is more likely to be at risk than others, or who is vulnerable to be exposed to it because of the risk that's associated with the hazard, right? So really turning our minds to all of that and really understanding that identification piece. And then looking at monthly inspections, surveys that you could conduct to your membership or the workers, floor plans, really looking at where do majority of the workers work. And where could those risks of exposure potentially increase, looking at their floor plan and mapping out where the workers work, where they come in, how many are there at what time of day, and throughout frankly, the whole entire day actually, to really be able to do that recognition piece. Looking at near miss reports and also accidents and illness notices. That can also extend to WSIB reports, potentially toxic exposure reports, as we mentioned earlier, that you would be, the employer is required to give you notice after 4 days of that occurrence. So we're relying on those pieces. And I think I already said that. Yeah, identifying workers and task where is likely to be exposed to COVID-19, right? So in a hospital setting, perhaps maybe someone that's giving one-on-one care would be likely to exposure, but maybe someone that works more solo may not be, but maybe have a second likely of exposure because of interaction of maybe they perhaps share the same locker rooms as those workers that have that direct contact, right? So really turning your minds to those types of things. In terms of assessment, you want to review new or existing policies, protocols, training programs that are related to IPAC. So pandemic plans, are updates ongoing? It protecting workers? As you folks have seen, things are changing every day. So a pandemic plan that was probably created back, let's say March 17th, should have changed by now, right? Definitely should have been updated and to reflect all the new information and guidance notes and things that has come out since. Infection control plans, have they been updated to reflect COVID, right? As I mentioned earlier, most of you probably already have an infection control program that has been created to address various biological hazards that we've dealt with, influenza A, for example, B, that's yearly, H1N1, scabies, things like that. So making sure that COVID has its piece there too, that's addressed under that plan. Measures and procedures to protect workers from exposure to COVID-19. What does that look like? Again, we don't want to just say every worker just gets PPE and off you go. We really want to, as Paul mentioned, really try to focus on looking at it from the hierarchy of controls and looking at engineering controls and isolation, and then going on to administration controls and then implementing PPE as the last resort or in addition to. Training, all workers are familiar with routine practices and additional procedures to avoid exposure to COVID-19. Some of you folks may be doing new routine and practices that you haven't previously done because of COVID-19, and making sure that that training is happening in your workplaces for those workers in order to protect themselves and avoid that exposure to COVID-19 because of lack of training. PPE. Again, that there is a training component definitely in that as well, making sure that there's fit testing that's happening, there's training records to confirm when people have been trained, when last, what did the training look like, making sure that it was adequate and appropriate training, and people really understood what was being conducted in those training sessions, especially when using PPE, and also supplies. What does the supply count look like? Trying to get some mechanism for the Joint Health and Safety Committee and you folks as health and safety reps to communicate with your employer, so you folks can look at putting in measures and turning your minds to things if supplies are in low, and what does that look like? And then legislation, right? Looking at what does acts and regulations say out there and how do we achieve compliances, or what guidance notes are out there or good best practices out there that we're able to get our employer to turn their minds to and to do in order to take that every precautionary reasonable protect the workers protect the health and safety of the workers, right?
All right, so after we've recognized, we've assessed, we move on to control. So the first thing is, can we eliminate COVID-19? And unfortunately, at this point, we cannot eliminate the virus from our world as of yet. But if there are particular workers, and we also have, we don't have just hospital workers, but we also have some municipal health workers that still can work from home, and that is a situation where you've eliminated yourself as the worker from exposure to COVID-19 by just not going out to work. So that, but if in terms of elimination, we're not at that particular situation yet. But when we look at substitution, which is the next step on the hierarchy of controls, we can't substitute COVID-19, but if you're using certain products or biological hazards or biological or chemical products in your workplace, when you're using for environmental cleaning, you have to ask yourself, is the product, it might be effective, but does the product itself create its own hazard? A good example is bleach. There's a lot of workplaces right now that have adopted using bleach for certain infection control. And you have to look at also possibly if there are less caustic products out there that can effectively kill the SARS-CoV-2 virus, but also that don't create a hazard to the worker and aren't dangerous to the worker. So that's how we would apply substitution. So when we look at engineering controls, we're looking at isolating the hazard or designing equipment and processes to reduce the source of exposure. And this is where the Joint Health and Safety Committee is going to really have to turn their minds to what kind of creative ways can we put in place to ensure that the control is over there, or the control is put in a certain spot in the workplace and it is not being spread all over the workplace through mechanical or engineering ways. And they can be achieved using physical barriers, machinery guards, equipment design, ventilation, either general, local, or natural. The screening of the clients and patients, or in this case, people that are accessing the workplace, have we gone through the proper screening protocols to ensure that it is effective and ensuring that no one who has COVID-19 is entering the workplace unless they're there to be provided care in like a hospital setting. And once they've and are we limiting the access points to your workplace? If you have multiple access points in your workplace or entry points, have we gone to a single point of entry to ensure that we don't have people that have skipped the screening process or have somehow circumvented it? And are we limiting the suspected or confirmed cases to an isolated area of the workplace? We have administrative controls, and what administrative controls mean, it's changing the way people work. So is there proper training? You'll be able to identify that through your assessment. Can we put new training in place? Can we put new policies in place? Can we put new programs or standing operating procedures in place? Are they ongoing? Are they being modeled as this pandemic rolls out? Self-monitoring to ensure that workers who do a self-assessment before coming into work. Shift work. Do we have to have all of our workers who are working at the same time be at the workplace? Can we do any kind of staggered shifting if it's possible within your workplace? Social distancing and physical distancing while you're at the workplace. Can this be achieved? Staggered break times so we don't have a lot of people within, say, a lunchroom. Is this possible? Can we encourage this physical distancing that we've been working on for the last couple of months? And other means of administrative controls include hand hygiene, cough etiquette, having washrooms just for staff only, and increasing those environmental cleaning and housekeeping. So it's important to really look at, and I've seen some as I've been out in the last couple of months, whenever I've had to go out for the grocery store or to get something that's important, I've noticed that everyone seems to be really creative in how we apply these engineering and administrative controls. And I think the committee, Joint Health and Safety Committees, are the best people to identify what those controls look like. So the final step is personal protective equipment, which is the last resort. And if you're working providing care, it is a necessity. But if we were required to wear PPE, it should only be used when hazard can't be eliminated or completely controlled by engineering or administrative controls. So as we are required to wear them for the particular work that you do when you provide care, ensure that you have proper training. You're trained in the use, the care, and the limitations of your PPE and how to put it on, how to remove it safely and fit tested if required for like N95 respirators. They should be clean, they should be stored in a convenient location, not create other hazards like discomfort or heat. And if that's the whole point, is that you don't want to be wearing any kind of PPE that's going to create another hazard. Once you've gone through the entire hierarchy of the control, it's important to evaluate to ensure that whatever you've put in place is protecting workers. So I would, like I said, we want just to think about and using the general duty clause with the current guidance notes that exist either or as a form of directives from the Chief Medical Officer or from the Ministry of Health or from Public Health Ontario, even though we see those as minimum standards, things like isolating or cohorting people that have COVID-19 in the workplace, those are kinds of controls that we would use to ensure that the employer is being compliant with the Act and to ensure that their infection prevention and control plans, even though they might be geared towards the patients or your clients, they also play a part in protecting workers at the workplace. So we've included here some resources, and since we're running short on time, we're not going to go through all your resources, but this presentation will be put into a PDF form, and you can access a lot of resources when it comes to health and safety in Canada and in Ontario. And right now we're going to move on to any questions. And just a reminder that we can deal with questions that apply generally to your sector, but not able to deal with issues that are only specifically related to your workplace. I see Kim had a question about, is this a new standards for terms of reference approved by the MOL? So that is, if you have a multi-site agreement, which means one committee for multiple workplaces, that is actually going below the standards of the Act. So that means that you have to have terms of reference which set out, because it's permitted by the MOL to have a multi-site joint health and safety committee. So you would need to have those terms of reference signed by both parties and by the Ministry of Labor. And they're normally, as John mentions, you normally either sign them off either once a year, you review them, or you would, if there's amendments that have to be made, you send them off every 3 years for the ministry to approve them. Is there any other questions that relate to, Felicia, did you want to go ahead?
I was just going to remind folks, in order to ask a question, you can post it in the chat bar. So there is an icon. If you're using your computer, you'll see the little chat bar there just to the left-hand side, lower left-hand side that you can click on, or upper right-hand side that you can click, left-hand side that you can click on. And if you're using your cell phones, that there's a little, it looks like a message icon again that you have to switch over. So you would not be able to see the presentation still up, but it switches over for you folks to be able to ask questions in the chat.
Well, since there's no questions and there's people who are still with us, I'll just briefly touch on on the ONA decision. So the Ontario Nurses Association filed multiple grievances in several workplaces in long-term care, and they brought the group of grievances to an arbitrator, and the arbitrator ruled that a lot of the directives that have been put out by the chief medical officer, especially those around directive number 3 and directive number 5, they should be implemented in the workplace. And those include the directive, as those who are in the hospital are aware of, is the point of care risk assessment, where if a registered worker, healthcare worker or regulated healthcare worker during a point of care risk assessment determines that a PPE, including N95 respirators, are required to provide care, then access to the N95 respirator shall not be impeded by the employer. So this really is important because it is something that was always existed within the duties of a registered healthcare worker. However, it has now been really tested in front of an arbitrator, and the award that ONA mentioned was able to achieve helped clarify that the Ministry of Labor is wrong when they say that they might be saying that they can't enforce directives made by the Ministry of Health or by the Chief Medical Officer, which is true. However, as we've learned today, when it comes to due diligence, when it comes to 25(2)(h and the General Duty Clause, these particular guidance notes around infection control are actually really good standards that apply to occupational health and safety as well. So we have a
we have a few questions, Paul. Thanks though for that. That's awesome. Little addition. So we do have a question that is asking, does there have to be an even number of management and worker members at the Joint Health and Safety Committee meetings? And how do you deal with this if there are more management members at a meeting?
Well, a lot of these, there's no requirement that there be even. The Act just says that there shall not be more management representatives than there are worker representatives. And I would find out, first of all, if you're a co-chair, I'd be either asking why that situation is and why there's no appropriate quorum that's going on. And it also should be spelled out if you don't have a health and safety agreement which sets out what the structure of the committee is going to look like, then you should at least engage the employer to put stuff down in writing to say that the committee is going to be formed of either 3 worker reps or 2 management reps or whatever have you, and ensure that if there's extra management there, that they are either as guests, or that they have no speaking role, or that they're just there for a particular issue.
Yeah, and that can be achieved in terms of reference or bargaining or a letter of understanding of any sort like that.
Yeah.
So our next question is from Kathy. Is the hospital responsible to keep health and safety committees aware of potential hazards, and if so, what?
Potential exposures. And
exposure, sorry.
Okay, so what we would say is we learned earlier that there's a duty of the employer to provide a committee of a report, the results of a report under occupational health and safety. So if workers are being exposed, there's 2 ways we can do this. We can ask for a list of workers who, or not the list of workers, but the numbers of workers who have been exposed. What job do they have? What particular classification did they belong to? And if they've contracted COVID-19 and they've let the employer know that, or if they've filed a claim with the WSIB, the Joint Safety Committee should be receiving that notice of all the workplace exposures.
Within 4 days.
Within 4 days. Now, those who fill out the exposure form but have not claimed an occupational illness, generally the committee will not see those. Okay. However, you can if the employer is aware that workers have filled out exposure forms, you can ask just for a result of how many workers have filled out those forms, and we would say that that's a report under occupational health and safety. And the employer should, as we've learned earlier, afford assistance and cooperation to the committee.
So we have a question from Cindy Dawson. When a Ministry of Labor inspector is not being cooperative and making errors in their order, how do we deal with this?
So this has been a common running theme, is that the Ministry of Labor has not been on the side of workers during this whole crisis. So if you think that the inspector has erred in their decision or has not written orders and that the employer is still not compliant with the Act, you need to reach out to your National Health and Safety representative and see about how your staff representative. Yes. Did I say health and safety?
Yeah, you said health and safety.
Sorry. So you need to reach out to. If you're a member of the committee, I would reach out to your local, and to determine whether or not we want to bring a lack of orders to an appeal. So once the inspector has been in, a person who feels as if that the inspector did not write enough orders or didn't write orders at all, you have 30 days to file an appeal, and that appeal can be brought to the Ontario Labour Relations Board. So,
and it looks like our final question is, sorry, were you continuing? Sorry.
No, it's just that you reach out to your local, and your local will contact their national staff representative, and we look at these field visit reports that the ministry is supposed to. Every time they visit, they have a field visit report, which will explain why they visited, and if there's no orders that accompany that field visit report and you still want them to write orders, then we'll look at it on a case-by-case basis to determine what is the likelihood of a successful appeal.
And can I just add to that, Paul? We really want to encourage you folks that if you are going to be contacting the Ministry of Labor, I know that you can, send in an email generally to them asking them questions and they'll give you an answer, or somewhat of an answer. But we are encouraging you folks, if it really is a complaint that should be made, and rather than sending the general question in the email, please contact the Ministry of Labor and actually do an actual complaint, so that way it will populate a field visit report or a lack of an order that then Paul or I can assist the local and the staff rep on possible next steps, if any. So then we also have, is the hospital responsible to keep health and safety aware? Oh, wait, no, we already answered that question. We have a comment. Our leadership, thank you for the information. And then we have our leadership doesn't encourage, promote consultation with health and safety? Always been a battle to find information. Any advice?
Yeah, so I would find out, I would put to the employer a list of some of the information that you're looking for, and to try and work with the committee at a committee level to try and get as much information as you can. And if you need to put that down in a recommendation that you're looking for information, or if you're looking to change the dynamic on the health and safety committee, you really have to ask yourself at the end of the day is this committee functioning? Are we identifying hazards? Are we receiving information? And are we making those recommendations? And if you're answering no to all three, then I would invite either a health and safety rep to come down and to identify where the roadblocks. And if it's just a matter of not getting the proper information, then perhaps we can make a complaint to the Ministry of Labor to say that you've asked for XYZ kind of information, and you're getting you're not being afforded any cooperation or any kind of assistance. That is a contravention of the Act. So we have to look at it on a case-by-case basis. But it is. I wouldn't say that being on the committee is easy, and I'm not painting out that it's always a harmonious relationship. But there are different strategies for different situations, and we're here to help.
Another question. It looks like the final question. Sorry, I know this was mentioned, but could you please remind us where we can find the recording after the webinar finishes? So you folks are able to find it on the QP Ontario website. But I believe that the recording will be posted after all of the webinars have been completed. So that should be May 18th. But I believe that the PowerPoint will be available right away.
Yeah, we'll work. We just launched this just a few days ago, so it's still a new thing, and we're going to try and get this up as soon as we can. Or we're going to try and get those who signed up for today's webinar. We'll try and get them. Maybe if we can email them the presentation or a link to the actual video and presentation recording as soon as we can. We're still working on the logistics. This is the first time we've ever done this, so we're just trying to find out how logistically if it's going to work and how we do this.
Yeah.
So thank you very much for joining us.
Yeah, thanks everybody.